All right, so this is our newborn baby, just born. We're gonna do an initial head to toe assessment. So most important thing when you're doing an initial assessment is to take note of every little bruise, abrasion, skin tag, birthmark, anything on your newborn. These are very important things during our initial assessment. So we're gonna start with the head. So the best way to assess the head is to take your hand, put it underneath the baby's chin, and sit the baby up. When the baby is sitting in that sitting position, that's the best way to assess your fontanelles. So you're gonna start with the top of the head by going from the center of the nose up, and you're looking for a fontanelle right about here. You're also gonna slide to the back of the head and you'll find another one back here. What they should feel is like a little divot, but soft. You may also feel a ridge in the head here, and that would be overriding sutures. The other thing that you're looking for in the top of the head is any caput, which would be kind of even across the suture lines, or a cephalohematoma, which is kind of more like a unicorn on one side. The other thing that I do at this point is I flip the baby over and look at the back of the head for any redness, any marks, any scalp electrode abrasions on the top of the head. And then I will sit the baby back down. Now, when you get the baby sitting back down, you're just gonna do a visual look at the face and look to see if it looks symmetrical, if the eyes are about symmetrical. The nose, you're gonna look at the ears to make sure that they're about even with the eyes and they're not low set. You're looking for any skin tags, would be about here on the ear, on both sides. And then you're gonna use your pinky finger to go into the baby's mouth. You're gonna go up the roof of the mouth all the way to the back. So you're feeling the hard palate and the soft palate to make sure there's no openings in the palate. Then you're gonna flip your finger and you're gonna feel the gum lines. What you're looking for is Epstein pearls. They're little like bumps on the gum line. Or any teeth, you may find that in a rare occasion. Aside from that, you wanna make sure that the nose is open and the baby is able to breathe through the nose. So you could just close the mouth, make sure the baby can breathe through the nose. Next, you're gonna start moving down the body. So you're gonna go to the clavicle. So you start at the neck and you're gonna work your way out towards the shoulder. You want to make sure you're not feeling any like crunching or cracking, like Rice Krispie type feeling in the clavicles. Then you're going to do your Moro reflex. So you're going to put your baby's hands up gently and then let go. And what you should see is that they bring both arms up symmetrically. If not, you're looking at either a clavicle issue or a brachial plexus. Then you're going to come down the baby's chest. So you're looking at the nipples are about even, the belly is soft and not rigid. You're gonna look at the cord and make sure that it's connected at the base, that you can see the 3 openings in the actual cord itself, and that the clamp is on well. Once you get through that, you're gonna move down to look for femoral pulses. They should be about the hip area. You're gonna do very gently to put some pressure there. If you do too hard, you will occlude the vessels. Once you feel those, then you're good to move down. If you have a girl baby, you're looking to see if the labia are swollen, if they're really flat. In a premature baby, you're looking for skin tags. You may see a little bit of discharge, and that's just hormonal discharge from mom, so no big deal on that one. If you have a boy baby, what you're looking at is that the tip of the penis, the opening is centered. If it's on the top, it's a epispadias. It's on the bottom, it's a hypospadias. And then you're gonna put gentle pressure here to feel the testicles. You wanna make sure there's one in each side of the sac. If the sac feels very tense or tight, that could be like a hydrocele. So that's something that the peds will look at. Once we're done assessing that, then we're gonna just look at the tops of the legs, make sure everything looks even, no birthmarks, no abrasions. I always do Babinski at this point, so you see your 5 toes on each foot. You're gonna go from the heel of the foot upward, and what you should see is they splay out their toes. That's a normal Babinski. Now we're gonna flip our baby over, and we're gonna look at the back. So again, we're just looking to make sure that the spine looks symmetrical. There's no Mongolian spots here on the butt, that everything looks pretty normal. Then you're gonna spread the top of the butt cheeks and look to see if there is a sacral dimple or tuft of hair. Those are 2 neurological issues that we would wanna know about. So if you were to see one of those things, it's definitely something to mark. And then you're gonna open the cheeks and make sure that the anus looks patent. And that is the basis of your head to toe assessment. The other things that you want to do would be to do vitals on your baby, but you're also gonna listen to your heart and listen for any extra sounds, any swooshes, which would be a murmur. You're listening for your diminished sounds in all 4 of your areas here. And that's your basic head to toe.